Hi, I'm Dr. Maria Conley, and today we're going to talk about the aortic valve of your heart and how it's perfectly designed for its function, but also prone to scarring or fibrosis as it wears out. In the case of severe aortic stenosis, the valve can literally turn into bone. As we age, the two valves on the left side of the heart, including the aortic valve and mitral valves, are the most likely to wear out. This is primarily because the valves on the left side of the heart are subjected to much higher pressures during the cardiac cycle. The most common condition affecting heart valves is aortic stenosis, or tightening of the aortic valve, which primarily occurs after the age of 70. As the outflow valve of the heart, the aortic valve opens and closes over 100,000 times a day, or 2.9 billion times by the time you're 80 years old. It keeps moving blood in one direction from your left ventricle into your aorta. When the valve opens during systole, the velocity of blood moving across the valve is about 1.35 meters per second. When the aortic valve is closed during diastole, it must withstand an axial pressure of about 100 millimeters of mercury while maintaining a tight seal. The aortic valve is made up of three shallow pockets made of very thin and flexible tissue. These pockets are called leaflets or cusps. The three cusps meet up in the middle and form a tight seal during diastole to prevent any leakage of blood from the left ventricle. During systole, the valve opens and a forceful flow of oxygenated blood is released from the ventricle, washing the leaflets of the aortic valve up against the walls of the aorta. Then the three leaflets close again, allowing the left ventricle again to fill with blood during diastole. The ventricular side of the valve is subject to much higher shear stresses than the aortic side of the valve. Blood tends to pool a little bit on the aortic side of the valve, allowing calcium deposits to form. The different hemodynamic forces on each side of the valve explain why scarring and calcification are mostly seen on the aortic side of the valve. Each leaflet of the aortic valve is composed of an extracellular matrix of differing amounts of elastin, collagen, and glycosaminoglycans. Embedded in this matrix are two different types of cells: the valvular endothelial cells, or VECs, and the valvular interstitial cells, or VICs. The VICs play an important role in the process of aortic stenosis, or tightening of the aortic valve. So, how does your aortic valve get tight, or how does aortic stenosis even happen? The initial phase of the process is very similar to that of atherosclerosis, actually. Over the years, hemodynamic stresses on the valve can damage the endothelium, which is the outer layer of the leaflets. This allows low-density lipoprotein, or LDL, and lipoprotein A particles to infiltrate the valve. An inflammatory reaction follows as macrophages, those scavenger cells, and T cells are recruited to the area. T cells release chemical signals like TNF alpha, which stimulates the VICs to turn into myofibroblasts. These cells produce collagen and secrete it into the matrix of the leaflet, causing fibrosis and scarring. The aortic valve gradually becomes thicker and less flexible. It is not able to open as widely to allow that oxygenated blood to exit the heart. As the valve orifice or opening gets smaller and smaller, the velocity of blood moving across the valve increases significantly, as do the pressure gradients across the valve. This is the initiation phase of aortic stenosis, which is similar to the process of atherosclerosis in arteries. However, The second phase of aortic stenosis, known as the propagation phase, is quite different. This probably explains why statin medications really do nothing to prevent the progression of aortic stenosis. In the final phase of aortic stenosis, the myofibroblasts sense the increasing stiffness of the matrix that they live in. These mechanical signals, in addition to chemical mediators like TNF alpha, trigger the myofibroblasts to transform again into osteoblasts, which are cells that produce bone. These are the same cells seen in the bones of your skeleton. The osteoblasts secrete vesicles filled with calcium and phosphate crystals, which are then deposited on the collagen matrix. As the once flexible aortic valve thickens and calcifies, it's no longer able to open as widely to let blood flow through it. The valve becomes stenosed or tightened. Once bone forms in the valve, the process is irreversible and you will require an aortic valve replacement within a few years. Studies have shown that up to 20% of tight aortic valves removed during surgery contain fully formed bone. Initially, your aortic valve is able to heal itself by forming collagenous scar tissue. However, as the vicious cycle of endothelial injury, lipid deposition, inflammation, scar formation, and bone deposition accelerates, the healing process becomes maladaptive. Once you have developed severe aortic stenosis or have severe tightening of aortic valve, becomes critical to replace the valve within a few years. A severely tight aortic valve will eventually always cause shortness of breath, chest pain, or even sudden cardiac death if the valve is not replaced. If you wait too long to have your aortic valve replaced, your left ventricle will likely become permanently damaged from the high pressures and you will develop heart failure. We'll talk more about that in the next video. Thank you for listening, and I hope this is helpful for you.